Doctors, nurses, and EMTs have read it. What is your best how the duck are you not dead moment? Worked as a phleb tech in a hospital for a while. Craziest thing I ever saw was this guy that came in having overdosed on Drugas. What Drugas you ask? Literally all of them. Alcohol, coke, MDMA, opioids, benzodiazepines, K2, and a myriad of other things. I went to draw his blood for some tests and he asked me if I could get him more Drugas from the nurse. I told him he would need to talk to the nurse about that. I ended up having to draw blood from the palm of his hand because his veins were so shot. Twas a fun night. My mother stabilized the neck of a drunk teenager that fell 40 feet out of a tree. He landed on a rock face up and split his skull in half. I met him years after this incident and had to get a metal plate on his skull. My mother described holding his neck and said she had to hold back vomiting because of how the back of his head was mush. Her gloved hands basically were holding a pile of shattered brain, bone, and skin, yet he was alive. She met him and said she was happy she could help, but told me later she was sad he turned out a moron, still fully functioning but a barfly. Edit. 1k upvotes. Thank you folks. I had a young guy, mid-20s, involved in a motor vehicle accident. He was alert and conscious despite the high impact injury. CT scan of his brain showed a massive subdural hemorrhage, which if it was in any other person, would have caused a midline shift. The brain matter gets pushed to the other side, i.e. left to right or vice versa. Luckily for him, he had a skull fracture at the area of the bleed, which acted as a burr hole, a medical procedure that we perform to prevent such midline shift from happening, thus saving his life, or his brain, for that matter. Guy was working at a factory. Somehow there was an accident and a 2 inches wide 3 feet long board got shot through his head, entered through tip of his nose and exited just below his skull on the right side. Face was a mess. Came in from another hospital intubated to see if our neurosurgeon could remove the board. We all assumed he was likely neurologically devastated permanently. We cut down the board and took him to CT to see what we were dealing with. As we were waiting for CT to result, we realized Guy's sedation had worn off and he was awake and could follow commands. You couldn't tell he was awake because his face was so swollen and macerated. We quickly reseated him. Turns out board missed nearly everything important. Messed up his internal carotid and lateral massive C1 vertebrae, but missed his spinal cord by about 2 millimeters. He walked out of the hospital 5 days later after several big surgeries to fix his face and IJ. Neurosurgeon said he'd have a crooked neck forever but otherwise would be fine. Not a medical provider. A friend was looking a bit pale. She was getting out breath when walking, had to take a break when walking less than 1 block. We convinced her to see a doc. She wanted to go to her PCP who could not get her until early next week. She goes to her appointment and they draw blood. Her O2 sats are fine. She goes home, and the next morning drives into work. Her PCP office calls freaking out. Her hematocrit is super low. She gets directed to the ER where she gets 4 units of blood. When she sees a GI doc, they ask her if the medical notes are accurate. She says yes. He replies with something along the lines of, "And yet I see you here, alive." Ike said it was the lowest he had ever seen outside of an IQ. The cause was thought to be a very slow GI bleed. She is fine now. Scribe here. We had a young guy come in with his girlfriend complaining of feeling slightly short of breath. He seemed pretty low acuity, so he ended up on a wall bed. Was pretty busy that night so he sat for a while. All of a sudden the nurse runs up to me and the doc and says this guy has a tension pneumothorax, collapsed lung. We check his vitals and they're all surprisingly normal. Pulse ox was 95 plus. HR was sub 100. Meanwhile this guy is literally just snapping selfies with his girlfriend. We did an exo later on, and boy he had a seriously collapsed lung, but was somehow just chillin' like nothing was wrong. I'm not any of the things mentioned above, but when I was deployed to Afghanistan, A lot of the honor soldiers would end up getting hurt in combat disproportionately to everyone else. Once I saw this guy come back from the front who had been shot from armpit to armpit. Shot in the head and stepped on a small IED that blew his leg off as well as one of his hands. He had lacerations all over and was bleeding quite bad. The honor medics and doctors didn't even bother to put a tourniquet on his leg. They just sent him on over to us with basically no first aid done. All of this while being transferred from heli to heli and an hour plus passing by. Somehow he made it to us alive and sort of coherent enough to look around. Besides the missing leg and his arms being ducked up, he lived and was okay. Former EMT, Canada. Guy crashed his motocross bike on course. Either an aneurysm caused the crash, or the crash caused the aneurysm. Either way, his brain was so swollen it was pushing out the base of his skull. His body was posturing. Punctured lung. etc. We booked it to the nearest ER and fully expected he'd passed away. Unexpectedly saw him approx. 6 months later in rehab in the same hospital. He was in pretty much a vegetative state but alive. I found out later he eventually passed away in a palliative care facility, but he got a year and a half to say goodbye to his kids and wife. Not a doctor, nurse or EMT, but I was on the patient side of this once. I was brought into the ER since I hadn't kept anything down for almost 3 full days. I couldn't even keep down a shot glass of water. It came right back up. Doc took some blood and wanted a still and urine sample while they hooked me up to the IV. No go on the still since no food for 3 days. But I could still take a piss. When they got their sample and ran it, the doctor came in and asked me if I had a history of drug use, including alcohol. I said no. They asked if I had a history of plaque, kidney stones, blockages, etc. I said no. They told me that bilirubin levels were ridiculously high. Like kidney liver failure high. Add on to this that over the course of about 3 hours in the ER, I had started to turn yellow due jaundice. They were calmly, yet noticeably, intrigued by this happening. They admitted me and eventually everything was okay. But it was a fun few days. Not one of the above, but in my line of work I met someone who had attempted suicide 7 times that could have reasonably led to a death. I was amazed that she had been saved so many times. 4th year nursing student here. I had a patient in cardiac unit who only had 10% ejection fraction. Basically it is a measurement of the percentage of blood leaving your heart each time it contracts. That explains why the grumpy old man only had 70/50 BP. I held his blood pressure meds but he got mad at me. Also called the doctor so he can get a surgery. He refused everything. The grumpy old man is still alive. I was a nurse at my county's prison. The area was having drug busts every 2 or 3 days it seemed. We get a batch of 10 in and everyone cleared perfectly except for this one woman. She was nodding in and out of consciousness and slurred her words. So I get one of the COs to obtain a urine sample to do a spot drug test. Sure enough, the whole test lit up. So she's placed in detox for a few days and then we would retest her. A few days pass and she's not getting any better. In fact, she got a lot worse. So we drug test her again and the test came back positive for everything from THC to benzodiazepines. I have the COs search her thoroughly in case we missed something, and sure enough this lady had 2 extra large condoms stuffed up her jail purse and they both were torn open and her vaginal canal was absorbing all those drugs. We counted a total of 200 pills she was carrying. By all rights this girl should have been dead, but she recovered after that. Triple GSW rolled in one night. First guy was shot in the butt. Second guy shot in the arm. Third got shot dead center of his chest. I sent the butt guy to my least experienced team. The arm guy had some difficulty breathing, so you figured bullet traveled to his lungs, so I sent him to my more experienced team. Then I saw the third guy with a big red circle of blood in the middle of his chest and knew that he was gonna be mine. Chest x-ray was negative. No hemo or pneumo, but also no bullet. Rushed him to CT. Nothing. Shipped him to the local trauma center. A friend who works there said they let him sober up and then sent him home. Nurse in a clinic in a rough area. Well, for us, lots of street people. Drug seekers. Refugees. In comes a dude for regular checkup, and I noticed that he had a blood streaking down his face. Not fast, but definitely something there. So into the room we go, with his wife, and off comes the hat. Now he had had a bee and lost about 1 stroke to his brain and chunk of his skull, so there is definite issues with cognition. Add that his wife is an addict, life isn't too great. Anyway, off comes the hat and out rolls the most unholy smell of rotten meat. Turns out that incisions on his scalp had become infected. As the infection progressed, he had necrosis of the wound and the wound edges became separate. So this dude had necrosis of his wound, and now I could see sections of his brain matter and rotting scalp. A definite holy shit moment. Dude ended up going to the hospital and getting treatment and skin grafts. Is still around. I had a patient admitted after being found unresponsive and essentially comatose. Workup was negative until the serum alcohol came back at 600. For reference, the legal limit is 80. He walked out of the ICU a few days later. I was always taught that that much alcohol would be 100% fatal, but not for this guy. 15 years and an EMT. We responded to an elderly woman who had fallen and cracked her head open. She was found by a family member. We had no idea how long she was down. She was unconscious when we arrived, and we honestly thought she was dead. We found her face up in the biggest pool of blood I have ever seen. Like, seriously, it looked like all of her blood. Not only that, but it had been a while because the blood had started to coagulate. It was like walking through a kiddie pool full of blood pudding. When we started to examine her, she came to and was not only calm, but pretty nonchalant. I must have bumped my head. Literally. The first thought in my head was, how the duck are you not dead? Palliative nurse here. Lady in late 30s, ovarian cancer with bowel mets etc. She obstructed regularly and decided not to have treatment anymore and pretty much came home to die. Normally it would take a week or so given her conditions. She lasted over a month and drank for 3.5 weeks of it. Her poor abdomen became so distended. She did eventually die. But a long time after anyone expected. My son got severe food poisoning a year ago, and by the time we made it to the ER his muscles were seizing and he was starting to act combative and hallucinate. His potassium came back at 2.3. Every single doc and nurse that came in questioned if it was accurate and freaked when they confirmed it. 4 days in ICU later he had bounced back. The docs couldn't believe it. Only later we learned how very serious it was. The doctor finally told us that by all accounts he should have gone into cardiac arrest and died. Only the fact that he was a 20 years old healthy male probably saved him. I'm a nurse sending a shout out to the girl who butt chugged vodka and had a blood alcohol well into the poisoning range. I don't remember the exact number. Over 0.350. 5+ times the legal limit. IVF and electrolyte monitoring. Discharged after a few days. You go girl. Veterinary professional working in emergency and critical care here. Work in LA, and we've had a busy week with the recent earthquakes. Had a small dog come in after falling off of the balcony of a 5th-story apartment. The dog freaked out after the building started shaking. Also, this little guy's blind and has a history of seizures, diabetes, and is 11 years old with no teeth. Come in. We stabilize him. And 10 minutes later his tail is wagging and he is licking us. Boggles my brain. But I'm glad this one had a happy ending. But still. WTF and how? Pregnant morbidly obese woman with type 2 diabetes, peripartum cardiomyopathy, and hypertension. She came into Lantridge and admitted she had not checked her blood sugar in 2 weeks. Had not taken her antihypertensives in 3 weeks. Blood sugar was 320. BP was 210/115. And her ejection fraction was 9. She complained of shortness of breath, dizziness, blurry vision, and decreased fetal movement for a week. Her baby was delivered at 34 weeks and did fine. No hypoglycemia, respiratory distress, or growth restriction. Mom recovered just fine after a day in the ICU as well. We couldn't believe it. A forestry guy who had a tree felled onto him. They had to cut it apart to get it off and evacuate him from the middle of the forest. But the ground was soft, so he got squished into it rather than completely squished. Still had a lot of broken ribs and a fractured pelvis though. Another guy had a herd of cows walk over him. Twice. Also lots of rib fractures and long bone fractures. Pretty sure one trampling would heal me. But farmers are generally pretty hardy. Not a doctor. Once my dad was fixing the roof of our house. He fell down and in the process of falling he ripped most of his left arm open to the bone. Casually wrapped it in a few towels and duct tape. Drove to hospital. And said I have a small problem with my arm, showing his blood-soaked towel wrap. Waited for 4 hours. Called me and my mom to tell us he will be late. Had to get 2 surgeries. He was annoyed that he had to wait until he could go on the roof again. Not an EMT. But my daddy's. Just recently we were driving home from the nearest city. We live in a very small town. As we are coming over one of the last hills on the way to our house, a man waves down our car and points to the wreck. There was nobody on the scene yet because nobody had a phone. And since my dad's an EMT, he always stops when there is a wreck with no responders. He called 911 and made sure the girl in the car was okay. About 30 minutes later we find out that the girl driving was drunk. She was going 60 miles per hour in a 30. Ran into a ditch. Flipped her car and flew about 200 feet. Somehow she ended up with only a small scrape on her leg. He said that in his 20 years as a firefighter, that's the farthest he's ever seen a car fly. An infant from an uneducated mother. The kid was fed exclusively with canned condensed milk, so he, or she, I'm not sure, was malnourished and very susceptible to infection. He came in with S. aureus sepsis, and during the stay he got pneumonia, bilateral pneumothorax, and went into cardiac arrest once and probably several hospital-acquired infection. He survived and was discharged after almost 2 months. One time when someone called about having something in the ass. He just wanted it out and did not want to go to the hospital. The thing stuck in his butt didn't look like any besides a little handle. So our medic went over and pulled it out quick and hard. It made a horrific noise that I can't describe. It turns out to be a 20 inches ladle. We stood there dumbfounded while this guy screams in agony. So we decided to take him to the hospital. I have some other stores if you guys want hear them, just ask. Patient had skin cancer. I think on his nose. That he refused all treatment for. It spread. Got infected with MRSA and fistulated, and over years his nose, eye and cheek basically rotted away. And I mean you could literally see his ducking skull. It was just exposed to the world. And that isn't even why he was in the hospital. He was admitted because he couldn't urinate on account of an erection that went on for days. His poor people looked like a microwaved hot dog. Overall, with how ducked his body was and where all the infections were centered, I don't know how he managed to be so enthusiastically rude and grumpy. Let alone alive. Bonus story: also had a patient with a blood sugar of 12. Still talking and answering questions coherently. How she wasn't in a damn coma is beyond me. Recent experience as a patient on the other side of this equation. Go to the ER with an abscess. The 12-year-old ER doctor sticks a needle into it to try and drain it. Then says job done. A nurse will be with you with antibiotics. I am left alone in a room and 100% forgotten about for 2 hours while I go into septic shock. If I didn't recognize the severity of my symptoms and actively go seek help, then I would have died alone in that room. Complete and utter ducking farce. Military. But not medical. We had a fellow airman have his hand go through a glass case. The cut was up his wrist. Server floor was covered in blood and fellow airmen freaking out. Ended up helping the EMTs get him to the hospital. Dude passed out en route due to the blood loose. Not a doctor, but I had to see a GP because I was getting exhausted 24/7 and dizzy fits when standing. The way I described it was I had just walked from my bedroom to the bathroom to make a glass of water the next room over, skin to running a full marathon without any training. Took my BP which showed at 70/40 when standing and was astounded I hadn't already passed out. He called ahead to the hospital and got me next day appointment at my local hospital where after another low BP reading, 4 blood tests and 9 hours later I found out I've got Addison's disease and was instantly prescribed onto steroid medication.